Hello and welcome to Dr.Smell-Bell-Verbal art-ery, that is the entertainment mode of learning subject based on a particular part of the body. Today we are going to discuss the glossopharyngeal nerve. I am the glossopharyngeal nerve of third branchial arch. I am motor to stylopharyngeus, secretomotor to parotid gland, and sensory to the posterior one-third of the tongue, including the circumvallate papillae. Posterior one-third of the tongue, including the circumvallate papillae. Also, the sensations from the soft palate, tonsil, as already said, posterior one-third of the tongue, and carotid sinus and carotid body. All are mediated through glossopharyngeal nerve. The components are special visceral efferent. Efferent is the particular motor thing, that is branchial apparatus, that is stylopharyngeus muscle. Yes. General visceral efferent is general visceral efferent related to the particular glandular secretions, general visceral efferents leading towards the otic ganglion and the parotid gland. General visceral efferents. General visceral afferents, that is the sensations, that is the particular nucleus of the tractus solitarius, NTS, that is from the posterior one-third of the tongue, carotid sinus, carotid body, soft palate, tonsil, all these sensations, general visceral afferent, that is GVA, are related to that, the sensations. Special visceral efferents, that is nucleus tractus solitarius, it is special, therefore tongue taste, posterior one-third of the tongue. General somatic efferents, that is general sensations, that is spinal nucleus of the trigeminal nerve, and it is carrying the sensations from the middle ear and also the proprioceptive fibers from the stylopharyngeus related to the inferior ganglion of vagus. So these are the components of particular glossopharyngeal nerve we have to remember. Upper medulla has got three nucleus ambiguous, that is branchiomotor for stylopharyngeus, inferior salivatory nucleus parasympathetic, as you know, for your parotid gland, and nucleus tractus solitarius for gustatory, that is the taste sensations, all in the upper medulla. How is it coursing outside, that is intracranial and extracranial? Intracranially, in between the particular olive and inferior cerebellar peduncle, olive and inferior cerebellar peduncle, and it comes out through the posterior lateral sulcus of the medulla, just above the vagus, that is 10th cranial nerve, and enters the jugular foramen. I call it as Jaffa. Wherein if you take the jugular foramen, anteriorly is the IPS, that is inferior petrosal sinus, in the middle is the GVS, G is the glossopharyngeal nerve, V is the vagus nerve, and S is the spinal axillary nerve. And behind all this is the IJV, that is internal jugular vein. In the Jaffa, it lies in between the IPS and the vagus nerve, as we have seen before. Extracranially, it lies between the internal jugular vein and the internal carotid artery, and it is particularly deep to the styloid process, and then it goes lateral to the stylopharyngeus muscle which it supplies, and it is in between the external and internal carotid arteries. Then it is just at the lateral part of the pharynx and gives the muscles of the pharynx. Then enters the submandibular region, passing deep to the hyoglossus and giving the branches towards the particular tonsillar and lingual parts. Then on the skull base, it has got two ganglions, superior ganglion and the inferior ganglion. Inferior being the larger, superior no branches. Inferior giving rise to communicating and the tympanic branches. The branches later are the number one tympanic branch for helping in the formation of tympanic plexus, entering into the tympanic canaliculus, and also for the lesser petrosal nerve, making the help of the aortic ganglion supplying the parotid gland. Number two is the carotid branch supplying the carotid sinus and carotid body. Number three is the pharyngeal branches. Number four is the muscular branches. Number five is the tonsillar branches. Number six is the lingual branches. Tympanic branch, carotid branch, pharyngeal branch, muscular branch, tonsillar branch, lingual branch. Tympanic branch, carotid branch, pharyngeal branch, muscular branch, tonsillar branch, and lingual branch. Thus, the anatomy of the glossopharyngeal nerve can be explained. Thank you very much for this patient listening.